Hello and welcome back, innovators, to the Simplified Integration Podcast. This is episode number 3, the one thing all chiros should implement in their office. Leonardo da Vinci once said that simplicity is the ultimate sophistication, and I agree. You see, the problem with the way that most consulting groups approach medical integration is anything but simple. In fact, it's the exact opposite. It's expensive, it's complicated, and quite frankly, it's exhausting. Enough is enough. There are far too many amazing integrated clinics that are struggling. Well, I'm on a mission to change that. What I've come to find from over 5 years working with integrated practices is that simplicity really is the secret. The old saying of less is more is true. Through a streamlined approach, I was able to create multiple successful 7-figure integrated clinics, and now I'm going to show you how you can do the same. Join me as I share with you the secrets to successful medical integration and practice growth. Join me on a journey to greater sophistication through innovation. I'm Dr. Andrew Wells, and welcome to the Simplified Integration Podcast. Now, this is also part of a 5-part series of the 7-figure shortcut. And the idea behind this first 5 episodes is to provide you a ton of actionable content so that you can get up to a 7-figure business very shortly, in under 90 days. And I'm going to show you exactly how I did that and how you can implement these things into your practice. So the reason I wanted to do this episode, the number one thing all chiros should implement, stems from this tragedy that I had in my car accident and being in the hospital. And the one question I have for you is, and this is the same question I had to ask myself, aside from chiropractic, if there was one thing that you could implement in your practice, like one therapy, one protocol, if there was one thing other than chiropractic that you could add, what would that thing be? And I want you to think about that for a minute. So as chiropractors, this is maybe a blessing or a curse, but because of the scope of our practice, there are so many different things that you can and chiropractors do implement in their practice. So you have your chiropractic office, maybe you could add physical therapy, functional medicine, decompression, weight loss, integration, stem cell therapy, like all these different things you could add to your practice. And some chiropractors add all these things to their practice and it just kind of drowns them. But if you had one thing to choose from, what would that thing be? And so I'm a really big advocate and proponent of regenerative medicine for a few different reasons. And so let me explain why. And one thing I want to address, and I usually don't talk about this, but sometimes chiropractors are kind of split. They're like, well, regenerative medicine is a medical procedure and either they think chiropractors should not be doing that. It's unethical. It's anti-chiropractic. They think that way. I used to think that way. I used to be a really like straight chiropractor. If it had to do with medical, if it came out of a needle, like I wanted nothing to do with that. But in today's day and age, and with the technology we have with cellular medicine, it's a completely different ballgame. Now, I know I'm not going to convince some of like the staunch chiropractors that like even won't even talk about nutrition in their office. But listen, like most chiropractors out there are at least a little bit open-minded to even have this discussion. So here's my stance on regenerative medicine. So this is used for patients, by the way, if you don't know what it's used for and what it is, regenerative medicine is, it can be an injection, it can be IV therapy, but it's using growth factors and cells that help speed up the repair and healing process in the body. So for example, this is not a drug, it's using cells, human cells, to help your body repair itself faster. So for example, you would use this for a patient who came in and has bone-on-bone degeneration on their knee, or somebody who's lost the joint space in their shoulder or has a rotator cuff tear. You can use it for hip patients, degenerative changes in the spine, the neck, and the lower back. So lots of different applications for arthritis. And that's like 95% of what it's used for in medicine. So let's say you have a patient that comes in and they have a worn out knee. Now, let's say they've lost most of the cartilage in their knee. What can you realistically do for that patient? Maybe try some decompression therapy. That might give them some relief for a period of time, but it's certainly not going to repair or regrow tissue in their body. You can try adjusting them, but because they have lost the cartilage, that's not going to grow back, right? You know that it's your knee doesn't have much of a blood supply. Realistically, what's going to happen is the patient's going to get frustrated in your office, and they're going to be either referred out or they're going to go on their own to their primary care doctor, who's going to refer them to their orthopedic doctor. And at the orthopedic office, they're going to get three things. They're going to get anti-inflammatory medication, they're going to get cortisone injections, and they're going to be referred to or scheduled for or referred out for at some point in time a joint replacement or invasive surgery. Those are your three options. It's medication, steroid injections, joint replacement. And having dealt with thousands and thousands of patients, I know the protocols. That's what they're doing outside of your office. So unless they have an alternative, that's what they're going to do. So the question then becomes like, what are there any other options? And there's a massive growing field called regenerative medicine that is offering options for these types of patients, like real options that work, that are very well researched, that gives your chiropractic patients a choice other than those three things. For example, I had a torn meniscus in my left knee, being a runner and working out and doing like CrossFit type workouts. I damaged my knee. Now I wasn't going to go through cortisone shots. I know better than that. I didn't want to have surgery. And so regenerative medicine was an option for me. I had an injection, and within a couple of weeks, the problem was completely gone. And I can use my knee like it doesn't hurt anymore. I can run on it. I can work out on it like it's completely fixed through regenerative medicine. Chiropractic wouldn't have done that. Nutrition would not have done that. Essential oils are not going to fix that problem. I'm sorry, you can't rub lavender oil on your knee and hope that's going to repair itself. So we now finally have the tools to be able to fix these kinds of problems in a way that also makes sense and is congruent with chiropractic. So, and here's the reason, guys. It is not an outside in approach. Yes, we're injecting something from the outside in. I understand that, but it's giving your body all the necessary ingredients to fix itself. You could make the same argument that nutrition does the same thing. And I know very few doctors who are against nutrition. So if you look at it, like sometimes people have a tough time getting around the needle part and the injection part. So my question for those doctors is this: if you had regenerative medicine in a capsule form and you could ingest it, that would fix a joint, a knee, a hip, a back, would that be okay with you philosophically? If that's okay, then it should also be okay if you could inject it or rub a cream on, right? It's not the delivery method, it's what it's actually doing in your body. And this is why I never had any kind of like hang up or qualms about regenerative medicine, because it is an inside out approach. It's using human cells, sometimes your own cells, to fix your body from the inside out. What could be more chiropractic than that? And it's funny, man, it makes sense to the medical doctors, but sometimes chiropractors have a hang up. So this is really, it's a really kind of cool time in medicine where there's this crossover, there's this bridge between medicine and chiropractic, which I think is always a benefit to your patients and our communities, right? So the question then becomes, if it doesn't harm the patient, which by the way, there are very few known side effects to regenerative medicine other than just having some swelling at the injection site. It doesn't harm the patient. It's beneficial. It's well researched. It's profitable. So the question then becomes, who's going to do this procedure in your community? Is it going to be the orthopedic doctor or is it going to be you? And I can promise you, I've helped so many doctors with this. Chiropractors are so much better equipped to handle this type of therapy than the medical doctors. They fumble, they mess it up. They're not good at the sales process. Chiropractors are so much better at selling, I don't want to call it like selling like you used car salesman. We're better at selling care and educating patients and getting them to take action on their health. So that's why I think chiropractors are really well suited. So that is my rant on the philosophy of regenerative medicine. You may agree with me, you may totally disagree with me. That's okay, but that's my stance. And then, so back to the initial question, if you had one therapy that you could offer, what would that therapy be? And I think that regenerative medicine is the best therapy for a number of reasons, but there's kind of like three categories that I go through when determining if something is appropriate to add to your office. So the first thing, there's three things. Is it legal? Does it help the patient? And is it profitable? So I want to start with the legal part first. So is it legal to do stem cell therapy or regenerative medicine in a chiropractic office? Yes and no. So the question I get is, well, how do you run this through your chiropractic office? You don't. So the way this works is you set up a medical entity. So it's a medical office that shares space typically with your chiropractic office. So in this medical entity, you have a medical doctor, typically a nurse practitioner, and your patients go through the medical entity, completely separate from your chiropractic business. That doesn't mean that you can't do the marketing or run the administration or help with the advertising. You can do those things, but all the patients are run through medical staff. So your nurse practitioner is doing the diagnosis, They're recommending regenerative therapy in appropriate cases, and they're doing the actual injections. So it's completely separate. There's no crossover. There's no worry about scope of practice, because it's not being run through your chiropractic office. That's how every chiropractor, for the most part, runs their regenerative medicine program. So if you're interested in that, that's something I can, how do you set up that legal entity? It's relatively simple. I can help you with that process. I've done lots of it. Pretty easy to do. Each state, if you're ever going to do this, by the way, here's my disclaimer. If you ever decide to set up a regenerative medicine clinic, please hire an attorney to help you, because every state has different laws and you want to make sure that you do it properly. So, all right. So we covered the legal part. Is it legal? Yes. Asterisk, make sure you do it the right way. Criteria number 2 in adding a new service, does it help the patient? That's so important. And you should always lead with that, right? Is it beneficial to the patient? So regenerative medicine is not new. It's been around for 50 years. However, the technology is, especially in the last 5 years, is just skyrocketing. We have a much better understanding of how regenerative medicine works, how to make it impactful, and also it's become a lot less expensive. It used to be like 40, 50, 60,000 bucks if you wanted to have this done. That's why the only people you ever heard of having it done were the professional athletes and celebrities who would go overseas to have these procedures done. But now there's a lot of focus on this therapy. It's an incredibly fast growing therapy because, number one, it works, but there's a huge demand for it. Patients are looking for alternatives to drugs and surgery. That's why chiropractors are so well suited to handle this type of therapy. And you can go on PubMed.com, all kinds of, go on any research site. And if you're curious about the research and efficacy behind regenerative medicine, there's tons and tons of research articles showing that it is an effective therapy. In fact, sometimes I get this from doctors I'm kind of waiting to see if this is beneficial to the patient. You already missed the boat, doc, because if you go to almost every hospital, every teaching institution around the country, and even the world now, they're doing regenerative medicine. So it's not that's kind of an old thing, kind of waiting to see if the technology is there. It is there. It's happening. It's a real thing. And then number 3, so this is the last thing. This is really important too, is it profitable? And when I say profitable, there's lots of different categories, right? There's you have to think about your value for your time, your value for the patient's value for money. Is it profitable for you and your clinic? So lots of different things to think about there. And of all the things that I've tried in my office, weight loss and decompression and functional medicine and nutritional programs, all these different things that we've tried, nothing has been more profitable than regenerative medicine. So in the years that we've been doing this, it's very rare when we went under $30,000 in collections. A typical month, we'd collect 30, 40, 50. We even had months where we collected 6 figures a month in just regenerative medicine. So it's a very, very profitable therapy. It's simple to add to your office. And then here's the other thing, is that this was maybe, the money part is important, right? Everybody wants to be profitable, sure. But it's not the most important thing. For example, if let's say you could bring in $50,000 a month to your practice, but it required you work 80 hours a week, would it be worth it? Some would say yes, some would say no. I say no, right? It has to be worth it for your time. And here's the beauty about regenerative medicine. It's a one-time, maybe 2-3 visit therapy for the patients. So they come in, they're paying you $5,000 to $7,000 per injection. They have the injection and then they leave. That's it. Some stick around for chiropractic care, but my point is that you've delivered $5,000 to $7,000 worth of care in one injection. So from a time perspective, it's saving you a massive amount of time for how much money you're collecting. So think of it this way. If a chiropractic patient came in and said, here's $5,000, I want $5,000 worth of chiropractic care. It'd be awesome, right? It rarely happens, but how long would that take you to deliver $5,000 worth of chiropractic care? It would take you forever, right? It take a long time. With regenerative medicine, it takes you a really short amount of time, one visit typically per patient. So, all right, doc. So there you have it. Those are the reasons why I think regenerative medicine is the number one thing that chiropractors should implement in their office. Make sure that it's done legally, and also it's great for the patient, and it's also good for your time profitability, your money profitability. And I hope you find this a blessing. And I really hope that you can implement this and make the next year and the year after that some of the best years in your practice yet. So thanks for joining me. I'm looking forward to joining you on the next episode, which is the fourth part of a 5-part series called The 7-Figure Shortcut. You don't want to miss out on that. Great to have you on here, Doc, and we'll talk to you next time. Have a wonderful day. Bye-bye. Hey, innovators. Thanks for listening to the Simplified Integration Podcast. The fact that you're listening tells me that you're like me, someone who loves simplicity. And the truth is, those who embrace simplicity are some of the greatest innovators. So I hope you got a ton of value from what we covered on today's episode. Be sure to subscribe and share with other docs that you feel could benefit from greater sophistication through simplification and innovation. If you've got specific questions that you'd like answered on this podcast, or you've got specific topics that you'd like me to discuss, just shoot me an email at info@integrationsecrets.com. That's info@integrationsecrets.com.